Hi, I'm Dr. Fuentes from the Fuentes Cosmetic Surgery Center. Like I promised, today I'm going to talk to you about the upper eyelid blepharoplasty. In essence, the upper eyelid blepharoplasty is a relatively simple procedure that gets you a lot of bang for your money. It consists of me removing some of the skin of your upper eyelids and some of the fat from underneath it. Before surgery, you will be advised to abstain from certain foods and medications, such as aspirin, ibuprofen, vitamin E, garlic, perhaps some anticoagulants that you might be taking, like Coumadin, heparin, Plavix. The procedure takes approximately 45 minutes to an hour to be done. It's usually done here in the office under local anesthesia or local anesthesia with some sedation. You go home the same day. You may resume some of the normal activities within 2 days, perhaps with sunglasses. But I would probably tell you not to do strenuous exercise like jogging for about 2 weeks. After surgery, you go home, obviously. You will be seeing me around, or the physician that you choose, in about 3 days. The suit should come out in around 3 days. There are certain things that we look at when we look at the upper eyelid. We look at the position of the eyebrows. We look at to see if they are symmetrical or asymmetrical. We look at the amount of skin that you have in the upper eyelid. And we look at the position of the eyelid in relation to the cornea. So when we look at the eyebrows, we want to see if there is asymmetry on it. Because if there's asymmetry, that means that there is probably more skin on one eyelid than on the other. Because remember, the eyebrow contributes to the amount of skin on the upper eyelid. We also want to know whether or not the brows are too low. Because if they're too low, the results of the upper eyelid blepharoplasty are just average. We have to do some extra things to try to make it better. The results are better when the eyebrows are in good position or relatively high. The upper eyelid blepharoplasty is most often done in conjunction with the lower eyelid blepharoplasty, and I will talk to you about that in the future. On occasions, eyebrow surgery is also performed. Nevertheless, some people choose not to do that because it increases the cost and the recovery. The upper eyelid skin is also important. There is a limit how much skin we can take out. If we can take out too much skin, then you won't be able to close your eyes. A phenomenon called as lagophthalmos. That is a severe problem. It will dry your eyes. So there's a limit of the skin we can take out. As it relates to the eyelid position with respect to the cornea, that is important because some people have low eyelid position, a phenomenon called as ptosis of the upper eyelids. If that is the case, we either try to correct it at the same time, or we advise the person that now, after I remove the skin of the upper eyelid, that might be more noticeable. The surgical procedure is what we call a semi-permanent procedure. Remember, nothing that we do lasts forever. What we do is that we bring the clock back. We cannot stop it from ticking. And so those are the things that we look. Now let's look at this lady here. She came because she thought that she looked tired and old. So you can see that in here, her eyebrows are slightly higher on this side than on the other. You can see the extra skin of the upper eyelid, and you can see the position of the eyelid as it relates to the cornea. So we took out this skin. She also went a lower eyelid blepharoplasty. So sorry. And you can see now the results after that. So you can see that there is a considerable improvement on this procedure. That's it for today. The next time I'll talk to you about the lower eyelid blepharoplasty. Thank you so much for your attention. And if you have any questions, call us, send us an email, or whatever you want to do, I help you. Have a good day. Bye.